Hello, thank you for being here today. Before we get started, I wanted to take a minute to take care of some housekeeping items. First, we will be running a live Q&A at the end of the webinar. So, we have enabled the Q&A feature in your webinar controls. If you have any questions, just pop them in there. And if you miss anything, don't worry, we'll be sending around a recording of this presentation tomorrow. Let's get started. Welcome to today's webinar, Rebuild Patient Volume Quickly and Safely. I am Emily Nelson, VP of Marketing at QueueDr. I will be your moderator today. It is my honor to introduce you to our presenters. Nick Redmond is the VP of Health Center Performance at Hudson Headwaters Health Network. Nick oversees a network of 19 community-based health centers with an annual volume of 400,000 patient visits. John Dudla is the Chief Information Officer at Hudson Headwaters Health Network. John oversees and implements the technology requirements for the network across a large geographic area for approximately 900 employees. And finally, Patrick Randolph is the founder and CEO of QueueDr. Patrick is responsible for delivering the industry's only fully autonomous, AI-enabled schedule management solution. Thanks again for being here. I'll turn it over to Patrick.
Thank you, Emily. I want to thank everybody for attending the webinar. I know there's a lot of different webinars out there, and I unbiasedly do think this is probably the most important one and the best one. And a major reason for that is Hudson Headwaters Health Network. You'll hear me refer to them as Hudson Headwaters Health Network and Hudson Headwaters as well, and sometimes HHN. But what makes Hudson Headwaters so great is regardless of your size, your geographic location, you're centralized or decentralized, Hudson Headwaters has experience that speaks to you and lessons that can speak to your experience. Right? They have over 100 FTEs. They're an FQHC in upstate New York. Right? So they have the mix of rural, but they also have many different locations. So the challenges they face are applicable whether you are in two location in the city or a rural or whatever it might be. In addition, Hudson Headwater is one of the most innovative customers we've ever had the opportunity to work with. And so the solutions they're there to share with you are fun, they're inspired, and most importantly, they're helpful. A little bit about QueueDr. QueueDr is an AI scheduling solution designed to grow patient volume and increase patient engagement. Right, and right now, the number one goal for everyone is rebuilding patient volume quickly and safely. And what QueueDr does is incredibly relevant in this moment. And we'll talk about why, but the most important thing when rebuilding patient volume is how can we remove the barriers between patients and care. I'm also going to get us all on the same page, right? This is going to be a summary to some of you, all of you, right? We've been living it. What makes COVID-19 unique, right? There's been a lot of challenges from it, of course, both personally and professionally, is that number one, there's obviously a decrease in patient demand. In fact, in most places, you weren't allowed to see non-essential appointments. So you saw a dramatic decrease in patient volume. But it wasn't just that. There's also the economic hardships. It forced many, medical organizations, large and small, to furlough employees. And that's, never fun, but it also makes rebuilding tough because you're not fully staffed. So Emily mentioned, that QueueDr relies on, is an autonomous solution. That's why that's so important, particularly for rebuilding from COVID. Because you don't have 100% staff capability. If you do have all your staff, you all know we're all a bit distracted at the moment. We're not all operating at 100% of our best selves. And the phases that we saw, and we'll talk about where we are now, this is good to take a step back. So I know, and I think Nick and John will talk about it better than I can, but we all remember the craziness of mid-March, right? It was, oh no, we got to, get rid of all these patients. We have to cancel those appointments. We got to move them to telemedicine as fast as possible, right? I know, many of you adopted telemedicine in under a week. If I had asked you if you could do that, you would have said absolutely not, but you did. So take those lessons learned and be proud. And then it was the coming months, right? It was, now we are on telemedicine with a little bit of in-person. How do we maximize our telemedicine volume? And now many are on the reopening, a phased reopening approach, where we're balancing safety and patient volume, both telemedicine and in person, and growing those in such a way that it's safe for the patient, but you're able to put everyone back to work. And then the phase after that is the one that will become in the summer and into the fall, is the patient surge, where pent-up demand from patients, who in the preceding couple months, weren't able to see the doctor, you weren't able to see them, but also some of them now who aren't yet comfortable coming into the office, they will get comfortable. So being prepared for that patient surge with a good patient access solution. This is the stat that underlies, every health system, every medical practice I've talked to. You strip everything away, this is it right here. Right? It's getting patient volume so you can recover. Crowe estimates it's got to be 110% of previous capacity for 6 months straight. It's not a one-time burst, right? But it's more sustained burst in patient volume, and that's really important. Not just because there's many patients who need care, but also you want to be able to put your people back to work. With that said, I want to turn it over to Nick Redman. Nick?
Thank you, Patrick, and thank you everyone here joining in today. Next slide, please. So as Patrick said, I'm the Vice President of Health Center Performance and Operations at Hudson Headwaters, and we're an FQHC, federally qualified health center in upstate New York. We call it the North Country. We are about 3 hours north of New York City, and we extend all the way up to the Canadian border with, as Patrick described, a very diverse patient population and demographic across our 19 health centers. So as Patrick alluded to, in the third week of March, no one was really fully prepared for what was to come out of all of the information out of New Rochelle and out of New York City. And it was an interesting time. I was actually up in Champlain right on the border when we started to really implement and make some swift changes in how we were going to approach the coming weeks. We had schools starting to close, businesses starting to furlough employees. And really, we were sort of watching this with wide eyes, trying to figure out how are we going to sort of evolve and adapt to this so quickly. We had a roadmap this year of what 2020 was going to look like for us, implementing different technology solutions. We had implemented QueueDr for cancellations back in the fall, and had high hopes for how everything was going to go this year, and sort of were turned sideways as everyone else was. But in that moment, we realized, this was an opportunity that we were going to be able to try and do some new things that we otherwise hadn't, specifically in the telehealth space. But as Patrick mentioned, volume absolutely decreased here at Hudson Headwaters during the first couple weeks. We saw a dramatic drop in patient visits down to about 30% of our normal volume. And we see about anywhere between 1,300 and 1,500 visits per day across our network. And it was a shock to see it down to some days 400 to 500 visits across the network. Realizing that, we needed to do things differently, we were able to really start looking at different options and realizing our healthcare delivery system needed to change. And with that came our quick adaptation and shift to delivering telehealth, which again is something that we didn't envision starting and bringing to life in just a week's time. But I'll turn the next piece of this over to John for the next slide.
Thanks, Nick. So again, thank you, everyone. My name is John Dublin, the Chief Information Officer here at Hudson Headwaters. I've been here for 14 years and have been in healthcare IT for over 30 years, and honestly can say I never expected to go through a couple months, like we've been through. As Nick mentioned, around the second week of March, that's when we really started to feel the effects of the COVID crisis, and as it exploded in the New York City area, as a state, we were generally concerned with what was happening. So we quickly saw appointments being canceled, and also made the decision, on our end to start canceling. There's really no such thing probably as a non-essential healthcare visit, but trying to cancel and postpone as many, non-emergent visits as possible. That was around the week of March 9th. And, late that week, actually over the next weekend, the announcement came out that all of the schools in our region were going to be closed, effective immediately. So we had an emergency meeting as a leadership team on Sunday the 15th, just to talk about the implications of our workforce, and if people have childcare issues, what's going to happen. And just a couple days before that, our chief medical officer had sort of saw the writing on the wall and had given us the directive that we really need to figure out how to provide telehealth to our patients, as the regulations were changing literally by the hour. And by the end of that week, March 20th, we were doing our first telehealth visits. And, we started training providers, training staff, more importantly, training our patients on this new way of care delivery, and, rolling out the technology, getting everybody comfortable with it. There were certainly pain points early on getting patients connected, but it's something we needed to do. We were really concerned about being able to stay connected with our patients this time. And, we used, like Nick said, we already had a relationship with QueueDr at that point, and we're able to leverage their tool as well to text a bunch of patients who had upcoming in-person visits and request and engage their interest in changing those to telehealth visits. So through text messaging, we were able to communicate with our patients that they had an upcoming visit, and with a simple couple of clicks on their phone, they could flip that to a telehealth visit, which really saved us a lot of staff time. And then we could just kind of deal with the exceptions at that point. So that was a real interesting, 3 to 4 weeks. We saw a huge drop in volume and really needed to change our care delivery. And then, knock on wood, as things started to progress and get progressively better, and we started to see our telehealth volumes bump up, and now we're starting to see, even in-person visits, jump back up. I'll turn it back over to Nick to talk about our reopening considerations. So back to you, Nick.
Thank you. Yeah, so the last 13 weeks have been pretty incredible, and to see our team sort of come together in a way to really work together and constantly evolve and iterate what we need to do, whether it be from a workflow perspective or a communication perspective. We knew that we had to change the way that we were doing things in order to meet the demands and the expectations of our patients, because we're about 13 weeks here. We knew that we were going to start coming up on patients who were going to need to be seen in person, and we were, holding hope that it was going to be possible to get patients in here as time has gone on. Thankfully, in our area, we didn't see the extremely high caseload of COVID, so we're actually in a phased approach in the state here, where we're into phase 2 now, where certain businesses are opening up. And I think people are realizing they've been, put in a situation where they've been able to utilize the telehealth to receive care in the interim, but are starting to realize they can come in for their in-person visits. So as John alluded to, we had used the switch technology at QueueDr, and we were able to get almost 3,000 patients converted over the past 13 weeks in May and June specifically, from in-person visits to telehealth, which was extremely helpful at the time. And now that we're kind of looking to rebuild patient volume, we're going to be looking to turn back on our QueueDr functionality for filling cancellations, which is going to be extremely helpful and kind of gets us back on track to some extent here, hopefully for the next second half of the year. We were fortunate enough to not have to close any of our health centers, but one of the things that we wanted to make sure we were doing was finding efficient ways and leveraging technology to capture the greatest audience of our patients in the most time efficient manner. So we did, at the time, we had furloughed 85 employees within the organization, some at health centers. We had non-clinical staff at the health centers. So that really required us to utilize technology to really connect with our patients as we had been doing pretty significantly for the past year or so. And during this time, we saw our telehealth visits reach a peak of about 40% of our volume during each day. And as time has gone on now over the past couple of weeks, we've seen that shift of patients coming into those being virtual. So, really when we look at, tools like we're speaking about here with QueueDr, it's really about making the most of this with the staff that you have and making the process efficient and easy for not only our employees, but also most importantly, our patients. Next slide. So when we talk about reopening considerations, again, I mentioned the phased approach and the timeline here that we're kind of bound to by the state regulations. But also we took an approach to really be sensitive to the idea of, how we want to risk stratify patients and make sure that we're not bringing in high-risk patients prematurely. We've developed some algorithms on the analytics side for assessing, those patients that are highest risk and converting them to telehealth. But as the caseload in the community has really gone down, we're about a 1.5% rate right now in our area. We've started to see more patients come in, and utilizing this technology has really helped. And again, it's really about how do we make it efficient and make it easy for everyone involved in the process. So as we've gone through this process of converting from telehealth to now back to inpatient, we're actually starting to see us get closer to our pre-COVID volume, believe it or not. It's been really impressive to see. We've brought back almost 90% of the employees that were furloughed, and we're starting to see about 85% of our pre-COVID volume, which has been quite surprising, but goes to show how important access to healthcare is for patients. And it's utilizing the various tools and technology solutions throughout this time has been not only well received, but patients have thanked us for offering different appointments for them to be able to come in and different pathways to receive quality health care in our area. Next slide.
So, through our partnership with QueueDr, one of the, bright spots, if you want to say it, through all of this has been watching how the technology vendors can respond to a need and really help out organizations like us as we work our way through the challenges of this. So, at the beginning, from the beginning of, COVID-19, which around March 9th, we kind of consider to be, our D-Day, if you will, we've canceled about 8,000 patients, unique patients. And just really concerned about, not losing those patients to care and making sure we stay in contact with them. We are a patient-centered medical home, and we're patient-centric, and we really want to keep our patients in a normal cadence of coming in to see us and setting up the reminders for those next visits. And as we quickly cancel appointments, we were at risk of sort of losing touch with some of those patients. So, we spoke with QueueDr, and they talked about a reBook beta that they were working on and asked us to participate, and we were certainly very welcome and excited to do that. Again, with employees on furlough, we're trying to do things as efficiently as possible and use as little man hours as possible, but also touch as many patients as we could. So through the QueueDr app, it created a user interface, and one of the nice things about QueueDr is it's fully integrated with our EHR practice management system. So everything that happens in QueueDr really comes from and is pushed back into our scheduling system. So there's really no need for any kind of manual intervention. But through the app that QueueDr's created, we can now pick a date range of patients where we've canceled patients. So, looking backwards in time, put in, and we're kind of chunking this up as we test out the beta and evaluate the results. But we can put in a cancellation date range. And then also if we want to limit, how the volume of text messages that go out and manage our availability going forward, we can choose it by provider or different types of appointments. If we want to focus on certain appointment types first, we can offer that availability. We can look at the cancellation reasons. So some appointments might have been canceled for a legitimate reason. And then we can also exclude patients who have had a visit, whether it be a telehealth visit or the visit that was scheduled since that cancellation, so that we're not unnecessarily bothering our patients. And then once those parameters are set, we can also pick a future date range to look out for appointment slot openings that we have. And once all of those parameters are set and we click the go button, those patients are going to get text messages, and it's going to offer them, certain appointment times and dates and times that are available, and they can just respond to that text message with the slot that they prefer, and QueueDr will automatically book that appointment for us out into the future, which, again, from an efficiency perspective, is just extremely helpful for us. So we're excited to, really, work through the beta with the QueueDr team and see how these results really impact our future volume. And it's allowing us to even further kind of plan for what our organization looks like and what our care delivery looks like in the post-COVID world. So at that point, I'll turn it back to Patrick, and next slide.
Thanks a lot, John. One of the things that's really inspiring about Hudson Headwater, and frankly, just all of you out there, is there's a saying, never waste a crisis, right? This is almost, the perfect time to, that long list you have of things you'd like to do on a rainy day, improvements you'd like to do, innovations you'd like to adopt and try. It may not seem like it, but the attitude that Hudson Headwaters has taken is, this is the time to do it. Right? This is the time, this is the excuse that is needed. And it's been, I think it's paid up very well for them. Obviously, by QueueDr, but also the other technologies they've been using. And I think, that's obviously a credit to the Hudson Headwaters team. And I think it's one of the, key drivers of why they've been so successful and why they'll continue to grow. When looking at, this period, I like to, as much as possible, look in the past. Right, and see in similar scenarios what happened. How did people get out of this? And not from a health perspective, of course, but reading more and more, what this period reminded me of for health systems and medical organizations from an economic perspective is a dot-com bubble burst. It's some of you may not remember, but it was an existential crisis for these dot-com companies, right? Many didn't survive, but many did, and they thrived, right? It was a crisis in that now it was no longer good enough to have a website, right? They needed so much more, right? There was an evening in the playing field, and they had to adapt and figure out the next decade, or 2 decades now, what was going to be the driver? What was the thing they needed to focus on? It wasn't just technology, but what was the core driver that allowed them to be successful? And, looking at Amazon, we are all consumers of Amazon in many ways. You can see their success there. And I think the lesson from Amazon, for healthcare, right? And not all of it's applicable, but I think the one thing that really is applicable is that Amazon decided to focus on something. They decided to focus on removing the barrier between the product they were selling and the consumers they were selling to. Every single barrier, remove them. Get rid of them, right? They thought 3 clicks were too many to purchase, right? They used, robotic inventory. 1 week, forget it. They wanted 1 day. I think for health systems and medical organizations, medical practices, big and small, everywhere, this is the kind of the lesson to take. It's how can we remove as many barriers as possible so that our providers and our patients get connected as fast and quickly as possible. And you will recover from this. You will thrive from this. Right? And it is also an opportunity as you are rebuilding to implement those innovative technology workflows you always wanted to do. And I want to thank Hudson Headwaters, Health Network for doing this with us and sharing their really valuable feedback, right? Because I can talk all day, but it's so much more valuable hearing John and Nick talk through the moment by moment and what they did, the different steps they took, amongst many of the challenges that you all face. So I want to thank them, applaud them for their incredible success, and open it up for questions. I imagine you probably want to hear more from them, so feel free to ask them questions.
Thank you, Patrick, John, and Nick. So I've got some questions here to start, but if anybody else has any more questions, feel free to put them in the Q&A bubble on your webinar toolbar. All right, this one's for John and Nick. Has it been easy for your patients to adapt to the technology? I'm assuming you have a younger patient panel that is easily adaptable to using the use of the technology in a healthcare setting. Can you elaborate that on that a little bit?
Yeah, sure, John. I'll take this one. So we actually instituted about a year ago what we call it's our patient advisory council, and it's made up of multiple patients from the various health centers that we operate. And it's interesting because most of the patients who are able to participate in that during the daytime, we've done a couple late afternoons, but predominantly it's people who are, I would say, 65 and over. The first question I always ask them in that setting, because we kind of break it down by a technology session, of what's working from a clinical session perspective and what's working from a non-clinical perspective. But the technology section, I always ask them, who here uses a smartphone? And it's always at least 8 out of 10. And what's interesting is that they're all, very well in tune with how to use their iPhone or Android device. And so we've really seen all ages and all patients really utilize the technology. And the nice thing that we see is that patients respond quite quickly. So when we were talking about the switch technology of moving patients from an inpatient visit to a virtual visit, we saw about 30% of the patients responded, and the response rate was incredibly quick. I believe it was 50% of the patients respond within almost an hour. So it's just sort of a natural progression because this sort of technology lives in all facets of patients' lives. So we really expect it, and it's showing that we're seeing it take place here in the healthcare setting as well. I get reminders for haircuts and offer appointments to switch. Patients look at the same way for their provider appointments. So we're finding that it's certainly not limited to a younger age demographic.
Absolutely.
And I'll just add to that a little bit. Give your patients the benefit of the doubt. I think sometimes we underestimate our patients and we use that as an excuse to not implement technology. But within the first week, one of our providers was like, I just finished the telehealth visit with a 90-year-old who was by themselves. So, I think it's something that I think we have to just understand that, for the most part, and we certainly have challenges, but don't underestimate your patients. I think, a lot of patients and people now are more facile with technology than we give them credit for.
Wonderful.
And
yes. Thank you.
Yeah, and if I may jump in, I did a study this morning that neither Nick nor John know about, and the data backs up exactly what they're talking about. The likelihood of a 65 to 75-year-old switching to a virtual appointment was the exact same as a 20-year-old. Right? The key is just make it easy as possible. So John and Nick, the data backs you up 100%.
That's good.
Here's another one. Here's another one for Hudson Headwaters. Were there particular challenges implementing this type of technology, especially since there are so many locations and you're spread over such a large geographic area?
Yeah, so I think from the telehealth perspective, the first sort of model that we were trying to implement was a controlled model with support staff. So we had providers come to our administrative office in a controlled environment with dedicated computers. And we quickly realized, even though that was kind of nice, that it was not scalable. And we really needed to get this technology rolled out across our 19 locations, some of which are, 2.5 hours apart from each other. So what we did, beyond that sort of controlled environment, is once we kind of had a workflow that we felt we were getting in a rhythm with, we just created some documentation and sent it out to our remote locations and said, anybody who's willing to try this on their own, give it a shot. And we realized that there was really no one size fits all sort of workflow for telehealth. Providers figured it out on their own. Patients figured it out. So certainly, being spread out the way we are, there were challenges, but, again, I think we also have to rely on the fact and understand that our employees can be innovative as well. And we really relied on that, and people stood up to the challenge.
Do you think that's a model for technology moving forward, a less centralized and more decentralized model?
Yeah, I think, again, with an organization as big as ours and as spread out as ours, obviously we need to have some standards in order to be able to support everything and try to have a consistent patient experience. Many of our patients go to multiple locations of ours, so we really want to have a consistent patient experience. But I think trying to rely on input and feedback from individual locations who kind of have unique needs, we want to strike that balance.
Yeah, and I think on that topic, we've talked a lot about this because we've gone through a pretty significant move from a centralized model to I would call it a hybrid decentralized model, and it's really about giving autonomy and what I like to call it our guardrails at our health center. So you can have the guardrails as wide as a 16-lane highway or as narrow as a bike path, and that sort of determines how much innovation you're going to get from people. And so we're trying to still figure that out. I don't think it's as wide as a 16 lane, but it's certainly not as narrow as a bike path. It's, I like to call it probably more of an 8-lane highway probably is where we're sort of landing on. But that's really the idea to what John just spoke about is it's getting feedback from people and allowing people to be a part of the solution. And I think the more we continue to do that, the more trust that all of our leadership, our providers, nursing staff, and so forth are interested in participating in betas as well as new technologies that we bring in. Because at the end of the day, they understand that all of this is designed to help make their experience with their patients most impactful.
Wonderful, thank you. This might be a question that both organizations can touch on. Patrick, maybe you can touch on the more standard, and then John, maybe you can touch on your guys' experience. But the question here is, how long does it take to implement, and what does the process look like?
Sure.
Patrick, you want to start?
Absolutely. The answer is always it depends on your practice management system with any technology. We integrate with, for us, we integrate with 9 different practice management systems. For, a switch in the cancellation products and no-show products that Hudson Headwaters uses, the implementation, we try to keep it as fast as possible, right? Because by nature of our product being automated, that allows implementation to be a lot faster. Right, because there's less education, less overhead, and so the implementation is usually, including training both staff and patient, is a week or 2. It can be, 4 to 6 weeks for your Epic and Cerner shops, where there's a bit more IT work, but we always rely on native APIs in every case to keep that number as low as possible, because especially during a time like this, speed is of the essence, right? You want to recover now, not in 5 months.
Yeah, and from our perspective, again, implementations really, depend a lot on your culture. So how quickly are you willing to sort of do some new things? Obviously, the technology pieces, the integration, those are rate limiting factors. But after that, it's like, how ready are you? We usually try out new technology at maybe 1 or 2 locations before we roll it out to the rest of our organizations. With QueueDr, it was pretty seamless. So we rolled it out after trialing it with a few providers, just understanding what rules we might want to put in place about what patients get selected in the future to pull forward. Once you've got those rules and recipes built, this particular application is pretty seamless to staff and very easy for patients, which was nice and made it easy to roll out.
Well said, Jen. I think the culture is the deciding factor there, and you guys have a fantastic one. It's actually why we worked with you guys in the first place. Another member of your team we had worked with at our old job, and she just was incredible and brought us in there, which was nice.
All right, I've got one more here, but if anybody else in the audience would like to add anything, please feel free to do so while we ask this question. The question here is, how does it work, QueueDr work or with or against other scheduling apps?
Yeah, right. That's a phenomenal question because everyone's got a lot of different tools, right? So you want best in breed. You don't want one solution that does everything because, you know, something's got to give. The quality will give there. And so we make sure that, you know, the product, of course, is integrated into your practice management system, right? So you're not monitoring, you don't have a bunch of dashboards up. You don't need to have 5 computers, you know, like a stock trader. And you also have the ability to customize. So, you know, in the patient journey, you know, QueueDr, once a patient's on the schedule, right? QueueDr will be trying to bring that patient in early as appropriate. Then it'll kind of give way to your reminders, right? Maybe you're using your practice management or another third party, that's fine. You know, as long as, of course, they're integrated with your practice management system. So you have that as your system of record. And so they flow seamlessly together. So obviously what you don't want is, you know, bothering patients with too many messages. You don't want to have staff, right, having to learn too many workflows, and more than one if you can help it. And you don't want to have a million computers up. You know, their job is to take care of patients, not to use technology. And so that's why we put such a fanatical emphasis on automation and integration.
Thank you. All right, and we'll end here then on one that's a little bit more conceptual. Where do you see digital healthcare in 2021? I'd love to get all of you guys' input on that.
Nick and John, you guys can go first.
Yeah, sure. John will follow up. But I think, you know, from our perspective at Hudson Headwaters, we've set out a roadmap to really, let's see, this is year 2 of our strategic plan, our 5-year plan that we put together 2 years ago. And it was really about how can we lay in technology in all, you know, aspects of our organization. So, you know, we consistently speak about it. We really think that all of this is going to play a vital role in how we deliver care in the future. And for us, you know, the biggest rate limiting step right now with regards to technology in our area, at least, is the regulations. And, you know, it's been a little bit tricky in the FQHC space over the years, but, you know, with this particular pandemic, you know, some of those restrictions have been loosened up. So, you know, I think for us, you know, we're always trying to find, you know, innovative ways to use technology and create a digital experience. There's some additional things that we're looking at right now to help us with clinical documents, medical records, search functionality. We're exploring different options for digital check-in and things like that. So we think it's absolutely foundational for us to advance our organization and have, you know, a solid digital plan.
Yeah, so a couple just points to expand on that. So, you know, 3 months ago as an FQHC, we really weren't reimbursed for telehealth services. So, you know, it wasn't necessarily on our radar screen at that point as something we were going to scale. And right now, what we're trying to figure out is once the state of emergency is lifted, what does the landscape look like from a telehealth perspective? So right now, we're trying to map out a strategy for how telehealth fits within, you know, our future going forward, you know, understanding that we're not really sure what the regulatory environment's going to look like. We certainly understand it's not going to be the Wild West like it is today, but we also think, you know, the cat's out of the bag and it's not going to be pulled back the way it was in pre-COVID world. And then, you know, to sort of expand on something Nick was talking about, we've been looking at sort of redesigning our care delivery system in general to go more toward a team-based care approach. And through those conversations, we were kind of looking at micro level changes to the patient visit and how that might work. So, you know, what we started to construct is more of a longer term vision document of, you know, 3 years from now, how do we see a patient visit looking, you know, considering what technology might be available. So, you know, we've kind of mapped it out a little bit. Some of the technology may or may not even be available yet, but we're trying to keep a longer term eye on, you know, what do we want to achieve from a technology perspective? You know, as Patrick said, as we evaluate other sort of vendors that can help us achieve some of those goals. Who's the best in breed of, for those types of services, and how do we see that playing a role in trying to keep our, platform as simple as possible, but also getting, real good technology add-ons to our EHR and making use of those. So, I really think the patient visit is going to look a lot different in 2021 and beyond. It's just a matter of, what technology sort of helps us get there and how we sort of find those mix of services.
Yeah, and I'll haphazard a guess, even though knowing, forecasting is always just, makes you look crazy. So I think, in the next couple months, and this will affect 2021, is budgets are going to be decreased, right, down to essentials. And that's, again, building patient volume. But I think in 2021, we'll see telemedicine settle down into about 20-25% of overall visits. I think, there'll be, like John said, a real focus on that patient visit. Where can remote monitoring come in, right? And what role that plays. But also, I think you'll see a resurgence in people realizing just how important the face-to-face is, right? It's a bit old school, but with providers, APPs and staff, the face-to-face is still vital. I also think we'll see a bit of an embrace in automation, not, clinical documentation, everything. It's as people look to, boost the productivity of their staff, make the most out of it. As John and Nick said, I think automation will get its moment in 2021. And that comes a lot because of interoperability, right? I think almost everyone on this call, your practice management system, it probably has a native API now, right? And it's relatively easy to build into. And so in 2021, in 2022, that means just best in breed tools. And so we'll see whether health systems, medical organizations are, going back to the, one platform for them all, or best in breed solutions. So that'll be, I think, the thing to watch.
Wonderful. Thank you so much. I want to thank everybody for their time today and for joining us for our webinar. Patrick, John, Nick, thank you so much for your insights. Have a great day.
Thank you.
Thanks, everyone.
Thank you. Thanks, everyone.